everyone. This is Dr. J with the Human Movement Institute, where we have improvement through movement. Today we will be discussing the mid and lower cervical extension mobilization exercise. This can be done with the towel or a self-care mobility tool laying down. This is indicated for human movement diagnosis, cervical extension syndrome, or cervical extension hypomobility. This is the individual that has limited extension or looking up and or can have pain in the neck, center, left, or right. If you feel down the base of your neck, you will feel a dip, then a bump. That first big bump is C2. As I work down, the bumps get harder to palpate or feel until I get to C6 and 7. C7 is the big prominent bump at the base of your neck. So let's say I'm pushing down and I feel right here at C3, 4 is painful. I can use the rung of a towel to slip up under that vertebrae. The mid and lower cervical joints are on a 45-degree angle, roughly. Think about shingles on a roof. So the force of pull to help the joint glide or move into extension or to recreate the normal arthrokinematic of the joint is a pressure from the towel or tool on this angle. So it's not a straight forward pull, and instead it's an upward angle pull. What's beautiful about self-extension mobilizations, if you're moving the right vertebrae in the right direction, all the pain will go away or be much better, or you can move much further into the range of motion. Please don't over-treat with this exercise. We recommend 10 repetitions, 1 or 2 sets, twice a day. Do not over-treat or do more, because you can end with post-exercise soreness or pain. We want to restore the ability to look up with less or no pain. How do we know this has been effective? After I'm done with the 10 repetitions, am I able to look up much further with less or no pain? If you're having a hard time with the towel, you can use the self-care mobility tool. This could be 2 tennis or lacrosse balls tied together, or you could purchase a tool that mimics 2 tennis balls tied together. This is a more general mobilization where I'm working for middle, extension, rotation left, straight extension, extension, rotation right. So where the first technique is much more specific to a particular vertebrae or level, I can now restore extension of mid and lower and even the upper thoracic spine. The mobility tool stabilizes a level so I can extend the other vertebrae over it. Some says that this increases or improves the normal curve of the neck, known as cervical lordosis. Others will tell you that this will at least improve the ability of the neck to extend both in the short term, if done once a week, and or the long term, if done over the course of your life. Maintaining cervical extension is one of the most important movements for anti-aging of the neck and long-term cervical health. We are all fighting gravity, and you'll notice that as we live across the lifespan, extension starts to become limited. In fact, there is something called a capsular pattern of restriction that's concomitant and or equates to arthritic change of the joints in the neck. How do we stop or slow this or restore it? We restore cervical extension. So if you've liked this very important video on cervical or neck health, please hit the like button, the subscribe button, and please share it with your family and friends. Until next time, take care, and I'll see you again soon.